Healthcare behind bars, the crisis facing incarcerated individuals awaiting trial. The crisis surrounding healthcare access for incarcerated individuals is gaining significant attention, as highlighted by John Bowman in his article for The Hill. This issue is a glaring oversight in the U.S. criminal justice system, particularly concerning the healthcare coverage that vanishes for those who are incarcerated while awaiting trial. Most of these individuals, who are presumed innocent until proven guilty, often enter the correctional system grappling with severe mental health issues or substance use disorders. As soon as they are booked into custody, their Medicaid and other health benefits are frequently suspended, according to Bowman. This policy, he argues, poses a serious threat to public health and endangers lives. Many pre-trial detainees find themselves without access to vital medications and necessary health care services. For these individuals, consistent medical treatment is crucial for maintaining both physical and mental well-being. The interruption of such care can lead to dangerous, and sometimes fatal, consequences. Bowman advocates for the enactment of the Due Process Continuity of Care Act, which would enable individuals to keep their Medicaid coverage during their pre-trial incarceration. Currently, the law dictates that Medicaid benefits are terminated the moment a person enters jail, regardless of whether their stay is temporary. If this legislation is passed, Bowman believes it could transform the justice system from one that focuses solely on punishment to one that emphasizes care, continuity, and respect for human dignity. He asserts that being arrested should not strip away an individual's dignity or their right to necessary medical treatment. Bowman points out that the link between untreated mental health conditions and incarceration is not coincidental. Many individuals find themselves in jail not because they pose a threat to society, but because they were denied access to essential health care prior to their arrest, and they often face even fewer resources upon their release. The article further notes that without a strategy to restore medical coverage, individuals released from custody frequently revert to the same unstable conditions, but now with even fewer resources to help them cope. Research indicates that individuals are 129 times more likely to succumb to a drug overdose within the first 2 weeks after being released from jail. Bowman poignantly states, "Our jails, already under-resourced and overwhelmed, have become the front lines of a behavioral health crisis they were never designed to handle. They are functioning as detox centers and psychiatric hospitals by default, which is not only unsustainable but also inhumane." He argues that ensuring health care for incarcerated individuals is not just a moral obligation but also a wise policy choice. It alleviates unnecessary suffering, reduces recidivism rates, and lessens the burden on emergency services and hospitals. Continuity of care is vital for helping individuals rebuild their lives and maintain their health. It also proves to be cost-effective by breaking the cycle of incarceration and crisis management. The conclusion drawn by The Hill is clear: denying health care to someone who has not been convicted is not a form of justice, it represents a systemic failure. If society genuinely aims to tackle issues related to addiction and mental health, then health care must extend beyond the confines of the jailhouse. Bowman calls on lawmakers to ensure that individuals in custody receive the necessary care to uphold their health, humanity, and dignity. Angelica Factor, a senior at UCLA majoring in sociology with a minor in professional writing, is passionate about addressing social issues through her writing. She aspires to pursue a career in journalism and enjoys exploring new cafes, flea markets, baking, and fashion in her free time.